Hi everyone. For the record, I would like to say that I was coerced by my sisters to do this. This is definitely out of my comfort zone, but hey, I guess we are living in a difficult, crazy time, so here I am. I would also like to make a disclaimer that I am not at all an expert with regards to the virus SARS-CoV-2 and its corresponding illness, the COVID-19. What I will be sharing today are supportive measures and symptomatic management that I personally advise my patients in my own practice when they have mild symptoms of the disease and are just managing at home. As most viral respiratory illness, most patients with COVID-19 will recover on their own. There is no specific treatment for this disease caused by SARS-CoV-2. Severe or worsening symptoms may require supportive treatment in the hospital. So please call your healthcare provider or call HealthLink 811 should you have symptoms of severe illness or worsening symptoms of the disease. Again, there are no targeted therapies for outpatients with COVID-19. There are, however, some traditional Western or home remedies that may provide comfort and alleviate symptoms of COVID-19. Please do not self-medicate. If you have medicine or remedies that you have heard that may help, please ask your healthcare provider. First, I would like to stress the importance of infection control. Infection control for suspected or confirmed cases to limit transmission is an essential component of care in patients with suspected or documented COVID-19. Wear face cover or mask even at home to contain respiratory secretions. Wash your hands frequently, cover your cough or sneezes, and avoid sharing personal items. Environmental disinfection in the home setting should also be done. Specific information can be found at the World Health Organization website, at the Government of Canada website, as well as your provincial websites. They even have information on how to make a disinfecting solution. For fever control, take acetaminophen or Tylenol 500 milligrams every 4 hours or 1 gram every 6 hours to a maximum of 4 grams per day. If you have asthma and you are using inhaled medications, avoid using the nebulizer as it generates aerosol particles which can carry the virus deeper into the lungs and also increases the risk of infection transmission. Switch to a puffer or an inhaler. For cough, take over-the-counter cough medications. Ingredients to look for are dextromethorphan for dry cough or guaifenesin for chest congestion. For sore throat, you can use chloroseptic throat spray to help relieve pain, and you can use this up to 4 times a day as needed. For nasal congestion, use saline nasal spray or rinse 3 times a day. You can also use the spray even without nasal congestion to potentially reduce viral load so there is less viral shedding. You may also use an antiseptic mouthwash 3 times a day. Some experts also recommend taking probiotics like Lactobacillus acidophilus 20 billion units per day, which may help reduce swelling from leaky gut, which can be due to COVID-19 shedding into the GI tract. And it also stimulates production of antibodies that may help with viruses or bacteria. Continue to eat healthy, especially food rich in vitamin C and zinc, as they increase your immune responses. Remain active and do physical exercises if you can. Move around the room or the area where you are self-isolating. Do deep breathing exercises, breathing in through your nose and breathing out slowly through your mouth. When sleeping, avoid lying flat in your back all the time. Lastly, remain positive and maintain wellness of mind. It is natural to worry about your condition, but avoid excessive worry and anxiety and find positive ways to stay mentally well. Before I end, I would like to remind everyone that prevention is better than cure. The best method to protect yourself against COVID-19 is to practice everyday preventive measures, including proper hand hygiene, wash your hands often with soap and water for 20 seconds, and using an alcohol-based hand sanitizer if water is not available. Follow good respiratory hygiene, cover your cough and sneezes. Clean, disinfect your home regularly, maintain safe food practices, avoid close contact with people who are sick, avoid unnecessary travel, especially to affected areas, and practice social distancing. That is maintaining 2 meters distance when outside, and do not shake hands, hug, or kiss, and avoid large crowds. Thank you for watching, and again, the measures that I have shared are those that I advise my patients. And if you have severe illness or worsening symptoms, please call your healthcare provider or HealthLink 811.